Dear colleague, the case that I present today is a fetus with increased fetal translucency. The patient is 34 to 12 weeks of gestation. We observe immediately that the thickness of the nuchal translucency is pathological and is found to be significantly greater than 2.5 millimeters, cutoff of normality. When we find a situation like this requires more attention for any signs of chromosomal anomaly, and in any case within the limits imposed since gestational age. Fetal anatomy. Through this transverse scan of the head, you realize that it's not only a pathological translucency, but we also observe a groma with edema extending to the chest and abdominal region. It's important to check the anatomy. It's necessary to note that the calvary is well ossified and closed, that the brain anatomy explored in this area is in order, and check that the abdominal wall is closed. Let us look at the profile, again as part of the screening of chromosomal. In this case, the profile is not flat. There is the nasal bone and observe also the ductus venus. See how the fetal anatomy is remarkably clear thanks to high-frequency linear probes that are used for the study of breast cancer. We observe the fine structures of the brain. We can already see at this time the posterior fossa and cerebellum. Of course, we cannot make the diagnosis of abnormal with certainty, but certainly for the management of this clinical case can exclude other pathologies associated. We observe the two orbits and the two crystalline having a regular feature. As we observe these details, you observe that it's very obvious the retronuchal hygroma. Continue to observe a smooth profile with a regular mentum. We know that in cases of increased translucency or hygroma, it's important to go to rule out heart disease, because often the non-absorption of the liquid in the region retronuchal is linked to heart disease. In this case and the following pictures, you can see the four chambers with the flow, Doppler high frequency, and also the orthopulmonary cross. This allows us to exclude, at least in part, major cardiac abnormalities. Remember that when we find a fetus with a nuchal translucency pathological, it's important to amniocentesis or chorionic villus biopsy to exclude chromosomal disorders. But we must not forget that sometimes the edema is associated with less common causes, such example metabolic disease. We continue the study of fetal anatomy. Observe the umbilical cord, which has two umbilical arteries. We observe the bony structures, very important when we look edema. We observe the movements and exclude fetal arthrogryposis. The fetus in question is very responsive. We must exclude, for example, clubfoot, abdominal wall defects, brain defects. We also observe the hands that seem regular. Fetal karyotyping is necessary genetic counseling and diagnostic investigation to rule out abnormal heart also. Look at the latest images. I, remember, I remind you that these images so clear were made possible through the use of high-frequency linear probes. Indeed, it's possible to observe the renal parenchyma, can understand that there isn't bowel hyperechogenicity. You can also see the genitals. So, you need to execute the fetal karyotype, genetic counseling, fetal echocardiography in the appropriate age, and ultrasound scans seriated. Thank you for your attention.